Due Process, winner of 12 New York and Mid-Atlantic Emmys, including the 2008 award for Best Discussion Series.
You got a bucket train, you give them like a quarter of a bucket twice a day too.
Out of lockup and down on the farm. It's one approach to inmate rehab. But with 1 in 100 behind bars is something more radical in order. And if the war on drugs has filled our jails and prisons, is it time to reform the drug laws? Part 2 of this Due Process special. Up next.
Major funding for Due Process provided by the New Jersey State Bar Foundation, committed to educating the public about the law, and by the Fund for New Jersey, supporting informed citizens for an effective democracy.
How to explain it? The U.S. imprisons more of its people per capita than any other country. 1 in 100 adults, 1 in 30 young men, 1 in 10 young black men. The Pew Center for the States shocked us with those numbers, a report that had us asking, how'd we get here? I'm Raymond Brown, and welcome to the second of our 2 special programs on the crisis on the cell block, a crisis playing out in New Jersey and across the states as a prison industry increasingly seen as unaffordable and ineffective is coming under new scrutiny. Here again to talk about the problem and some possible solutions, we welcome former Governor Byrne, retired Chief Justice Deborah Poritz, and former Newark Chief Judge Julien Neals. But first, as always, Sandy King starts us off.
Raymond, it's no wonder that the way we handle crime and punishment in this state and in this country is under attack, when you consider that 95% of all prisoners will be released and 65% of them will be jailed again. Some look to our laws and how we enforce them, especially when it comes to drugs. But state corrections officials have been working from inside, trying to break the recidivist cycle with some creative approaches to changing lives.
I hear something saying,
Here, it's the cows who are chained up, but their keepers are the real prisoners.
It's another year to go. Yeah, I have to be a total about 33 months when I'm finished.
They are doing time, but in a decidedly different way. They may sleep in a lockup, but their days are spent here on Jones' farm.
I usually come down 7 o'clock in the morning, stay all day.
Where milk is the product and cows the companions of choice.
They're nice cows, so start to love them and stuff.
The idea is twofold: giving inmates work experience while providing state institutions with milk, using nearly free labor.
It ranges from $3 a day to $5 a day. This is one of the higher paid jobs.
And while they're milking here,
Hook the pump up, takes 3 to 5 minutes to milk them out.
they are slicing.
We cut up like onions, peppers, everything.
And sautéing.
What is it, stewed zucchini?
And running a real restaurant, open to the public.
Mate's Inn is a full-service culinary education restaurant, and we basically let the inmates run the restaurant from soup to nuts. We have maintenance, dishwasher, all the way up to sauté, saucier, expediter.
It ain't like we get a paycheck or nothing. Well, the state pays $7 a day.
So if there's no money, what's in it for the inmate?
Better being here than stuck in the prison surrounded by mail all day. So I come here, you get to learn and work. I mean, not a lot of guys down there get that opportunity.
It's good that DOC allow a program for us students, to learn new skills, hopefully be better in society when you get out there.
And here, interaction is the human kind.
Thank you.
Yeah. Right over here.
Right here.
I find them very, very nice, very respectful, very attentive. I mean, they're a delight with us and with the baby. We don't even have to order for Max. The guys already know.
And what they learn here might actually lead to a job on the outside.
This is everything right here that we're going to use to cook for the line. Everything, like, this is the menu.
Our goal is to get them into hotels and casinos. And they sign a 4-month contract with us. And in that 4 months, they'll get a certificate through Burlington County Institute of Technology and a ServSafe sanitation certificate.
It really helps you on the streets. You learn new skills, like if you never did culinary arts, cooking anything, you learn new things.
Yeah, it was more chicken, right? You put up, you bring it.
Things that might help in a practical way once you're back home. Something less likely when it comes to milking cows.
The training programs, most people spend their incarceration time on a waiting list trying to get into those. So we really need to expand and improve the training programs. They have to be made more relevant so that people aren't being trained for jobs that don't exist anymore in the community.
Learn a little something. I ain't gonna take it back home with me on the streets, but just knowing this, you know, a little different experience, different side of life.
Every day they're up early and out to work, and we feel that helps them prepare for life back on the street. Just a work ethic kind of thing. That's always been our aim.
My feeling about most of those programs is that they work fine, but they only touch the lives of a very small number of people who go through our prison system.
So in terms of being smart with respect to crime, it's a matter of, yes, punishing those who have offended society, putting them behind bars. But once they return to society, they return to society with a plan for getting on with their lives, for paying taxes, for contributing toward child support, for making a contribution to their community.
And no one claims that learning to chop vegetables or milk cows can do all that. But for the fortunate few, it's a chance to do time without wasting time.
Can't you hear them saying, I'm going home one of these days. I'm going home, see my woman, whom I love so dear. But meanwhile, I've got to work right here.
Well, they're two small programs, but they're part of a growing state acknowledgement that you can't just warehouse people in institutions where all they may learn is to be a better criminal. That you can't just release them without real support and expect that they'll be able to find a better way. So the state's now spending more than it ever has before, not just on in-prison programs for education and training, but on a range of reentry strategies designed to keep released prisoners on the outside. The price tag this year, including both state and federal funds, Raymond, more than $200 million.
But the question is rehab and reentry enough, especially in tough financial times, or do we need a more radical approach? Maybe reform of the drug laws. We'll get some expert opinion from former Governor Byrne, retired Chief Justice Deborah Poritz, and Newark's former Chief Judge when we come back, so stay with us.
When they leave prison, get them on a program that will keep them out of prison.
There's too many people being let out on bail that shouldn't be out. Keep them in prison.
I don't believe in putting criminals back out in the street because they're overcrowded.
Check out some of the people that's actually in there for misdemeanors and get some of them out and put the real people that need to be in there.
People that get arrested for like marijuana or something like that really should have rehab instead of be sitting in jail.
They'll jail these people while it costs taxpayers more and more money.
Personally, I'd like to do a lot more fair trials and stuff like that because a lot of people in there are innocent, personally, in my opinion.
Can't just let them out and let them loose on society and you know, God help us. I mean, to me, there's a lot of people who ought to be in jail who aren't.
And back again to help us sort out the complex question of what to do, three very distinguished guests. former Governor Brendan Byrne, retired Chief Justice Deborah Poritz, and Newark Corporation Counsel and the city's former Chief Judge Julien Neals. Welcome to all of you. Chief Justice, let me come back to you again, because last week we ended with a conversation in which we had talked about the failure, apparently, of the war on drugs and the fact that perhaps we're going to have a renewed conversation in this state and around the country in light of the incredible cost of maintaining a system that doesn't seem to be working. If that's true, should fiscal concerns drive our discussion about something that has, on the one hand, the security concern of the citizenry, and on the other, civil and even human rights questions?
Well, in this case, it's interesting. Fiscal concerns actually come together with a changed view of the system. It is extremely expensive to keep people in prison, especially state prison. If we look to alternatives for people who are low-level offenders, first-time offenders, nonviolent offenses, people who are really there because of a drug problem, and look for alternative ways of handling these problems, it's less expensive.
So this may be an opening to look at an issue that's been of some concern. Governor Byrne, let me ask you this. If we start at the legislative end, before we talk about the system of incarceration or release, is there anything that you think we ought to rethink if this creates an opportunity?
Yeah, well, you know, as we speak, there's a bill that's actually passed the Senate and is pending in the Assembly that would, in effect, decriminalize marijuana for medical purposes under very strict control. But I think it shows a change in the attitude. I would have, when I was governor back in the 70s, I announced that I would sign a bill if they would pass one, decriminalizing marijuana. And I think it's...
But medical use is a pretty narrow slice, and
yes.
It's not addressing the population that's in the prisons. Are you saying that this is like the canary in the coal mine, or a symbol of a greater openness to discuss this issue?
Oh, absolutely. And I think there was a great sentiment out there, and you see it reflected in the jury reaction to marijuana cases. You don't see a marijuana case being seriously pursued by a prosecutor today. You just don't see it.
Judge Neals, if you could for a moment be the emperor of New Jersey and bring about a significant change in the drug laws, what would be the most dramatic change you would make?
I think we have to get back to the aspect of really allowing the judges latitude to deal with the individual cases on an individual basis. It's almost an oxymoron when we talk about mandatory guidelines with regard to sentencing, because a lot of times what's between the guidelines is very narrow. But I think what really has to be the focus is being able to focus on the individual case to try and find what is going to be the most appropriate individual result, to try and not foster or keep having the repeat offender.
So without putting words in your mouth, would you essentially throw out mandatory sentencing with respect to drug offenses?
Not necessarily throw it out, but take a better look at what we want to impose as guidelines and truly have those as guidelines, not something that necessarily is going to dictate what a judge has to do at the end of a case, but something that realistically a judge could work within that could even have some other more rehabilitative alternatives as part of those guidelines.
Chief Justice, I guess I have to make you emperor as well and give you a chance. If you didn't have concerns about re-election, but could bring about a significant change in our drug laws, what's the most significant thing you would attack?
I would re-examine the entire system for dealing with low-level drug offenses. There are in our prisons today over 6,000 people who are there on low-level drug offenses, non-violent offenses. Some of them a first offense, some of them with a couple of priors. I think the drug
and that's
court...
part of the population that contrasts us with it. We have about 50% non-violent drug-related offenders in our system, which is one of the big units or cohorts. So how far would you go? What would you do?
What we have right now is a drug court program in the court system that is now statewide that evaluates these people and moves people who volunteer into an alternative system. of treatment and intensive supervision, bringing them back after treatment into the community, giving them assistance in getting back into the community, and diverting them from the prison system.
But you've already just recommended a drastic change, or at least the beginnings of a change in how we use drug courts to that effect.
Yes, I would expand the drug courts. The task force is recommending expanding the drug court system to reach people who are not aware of their need for treatment, are not volunteering for treatment for a variety of reasons. They've already served time because they couldn't make bail. They've been in prison, they figure they only have a little bit more to serve. They're not going to go into a drug treatment system through the drug courts. That's really difficult. This is not an easy thing to do.
So you're talking about something that's a fairly drastic change, which is people in drug programs who haven't volunteered to go to the
That's correct. There's a lot of empirical evidence that those people can be evaluated, that many of them are amenable to treatment, and that we would be better served if we diverted those people into forms of treatment and supervision.
But you also favor this because the drug courts would have the capacity to get around some mandatory minimums. Get around is the wrong phrase, but effectively...
It's a different system.
Okay,
and so you're not dealing with
Now,
those.
before we get to your different system, Governor Byrne, could you be enticed to consider broad decriminalization of some categories of drugs as a reform?
I think we made a mistake to begin with by saying we're going to talk about legalizing drugs. We're never talked about legalizing drugs. We're talking about decriminalizing, and you used the word accurately just a minute ago. Marijuana is really decriminalized now because nobody enforces the marijuana statute in the first instance. And you talk to prosecutors, they don't do it. It's something you get a $25 fine for at worst. Juries don't.
But would you go further than marijuana?
Yeah.
In terms of looking at decriminalization?
Would I decriminalize
any other drugs? Any other currently controlled dangerous substances?
I think that we handle it wrong. It's drugs are not a criminal problem; they're a social problem, and we've got to start looking at them as a social problem.
So you would consider decriminalizing heroin, cocaine, and other drugs?
But not doing that and just walking away. You got to do that and get a program of dealing with what the problem really is.
Now, Judge Neals, one of the numbers that jumped out at me is the Drug Policy Alliance number, where they study each class of incoming inmates. Each class of incoming inmates in New Jersey is going to cost us $700 million, an astounding number, especially if half of that class is nonviolent drug offenders. If you had a slice of that money given to you by the legislature to use in Newark and other cities, I know reentry is one of your favorite programs. Now I'm going to challenge you. Is that where you put the money on reentry?
I think you put the money on reentry, but you also have to put the money to support some alternative sentence structures. There's certain things in Newark that we're investigating. Community court is one where at the sentence phase, you try and have a sentence that's geared towards what a particular problem that a defendant is suffering from. And if we could put resources more towards that rehabilitation at that point, then we can automatically reduce the amount of inmates going into prison, which is going to lead to an automatic reduce of costs. I mean, the fact that the United States would have a quarter of the state's prison population doesn't speak well for the land of the free. So we have to start looking at some other alternative at an earlier point.
All right, now, Judge Neals, you're currently a friend of mine. I hope you will be after this question. After Governor Byrne persuades the legislature to consider, at least one house, decriminalizing heroin, cocaine, and marijuana, coupled with broad-based rehab and re-education, and they come to you for a quote, what are you going to say?
With regard to the decriminalization
broad-based
aspect?
Decriminalization with all the bells and whistles and supporting institutional supports that you can muster. Are you in favor or not?
I'm in favor of, to a certain degree, revising the laws to take a more realistic assessment of what's going on in our neighborhoods. And just by way of an example...
Can Brendan count on you for your support?
He can count on my support, but I'd have to see all that language first that goes in there. And I just bring a quick example of the Anti-Drug Abuse Act, for example, where it analyzed crack cocaine versus powder cocaine in this 500-to-1 analysis. Well, that kind of skews the numbers to a degree for an urban center like Newark, for example, and you're automatically going to have an increase in the prison population because just on the street, for example, crack is a lot cheaper. And most people wouldn't have the cocaine. So when you get charged the same way and face a certain sentencing structure for what would be a larger amount of drugs, you're automatically going to increase the prison population for a low-level drug offender.
Since I'm losing all my friends, Chief, I got to ask you the same question. Are you going to support the Byrne proposal, which is broad-based decriminalization with rehab, education, and the other supported needs that would be required?
I'm not sure at this point I would be ready to go that far. I'm certainly ready to treat people who are drug addicted or have a drug problem and have committed nonviolent crimes in a very different way in the criminal justice system. And I think that would be a good start. And after we do that and we see how successful that is, and part of what we're recommending is that if we expand the drug courts that way, that we seriously evaluate the effectiveness of the program, the recidivism rates afterwards. And if we see that that's very effective, then I think I absolutely agree with the governor that these are social problems and that we need to move on to treat them that way and increasing expansion of this kind of programming to help people to take their place in society in a very different way is what we need to do.
Is the expansion of the drug court enough of a bite at the apple to make a difference? Or
no, but the whole society that's interested in keeping the drug laws as they are. There's a whole segment of our society that makes a living on it, on both sides, both the criminal side who want to do this, and the law enforcement side. There's a whole segment of law enforcement that's dependent on having drug laws.
So how do we break that cycle?
I just told you.
Okay.
We certainly shouldn't have mandatory sentencing. We certainly should re-examine laws like 3 strikes and you're in. They operate very unfairly. We should look at the way we penalize people, how we add on penalties. We need to look at the whole structure of the system to make it fair.
Now, Judge Neals, there's been not just these massive numbers, but a federal appeals court in California said they need to reduce the state prison population by 1/3. I mean, a massive reduction. There's been at least 10 years of talk about reentry, support from your mayor, the current governor, but it doesn't seem as though there has been a massive redirection of resources in a way that's measurable in terms of reentry. Why is that process of figuring out how to bring people back, especially nonviolent offenders, after they've done time?
It's critical. It's crucial. I mean, when you look at the statistics, even from the Pew report, you see what the percentage is of those who are out who go back in. In one category, it's 2/3. Another category, it's half that will go back and actually serve prison time within a 2-year period. If we don't really focus on that reentry portion, we are just feeding into a vicious cycle.
Well, have enough resources been directed to it? Do we need more money? Do we need more
Absolutely need more money. Absolutely need more money. And if you look at the amount of money that's spent on prisons just on a yearly basis, it would automatically reduce the amount of money you'd have to spend on prisons when you refocus it on such efforts as reentry.
All right, we're down to our last 30 seconds each. But when we come back in 10 years and do this program again, are we going to be talking about a missed opportunity now, or are we going to be talking about new questions and new horizons in terms of drug policy, how it relates to incarceration?
We should stop trying to do better what we shouldn't be doing at all.
Chief?
We should be treating people and getting people back into society, which is another way, I think,
but does it
of
challenge
saying
you
the same
to know
thing.
that there's a major fight in this society about health care for non-inmates, that when you frame this as a medical problem, that isn't necessarily a magical political solution?
You're right. It's a difficult problem, but I think right now, even though you know, this is difficult to do because it costs money. It does, as has been pointed out, reduce prison expenses.
Okay. Well, it sounds like we haven't solved all of this problem, so you're going to have to come back again. But in the meantime, with my thanks to our distinguished guests who stayed with us through these two important programs, that's Governor Byrne, Judge Neals, and Chief Justice Poritz. That's it until next week. For Sandy King and all of us here at Due Process, I'm Raymond Brown. Thanks a lot for watching.
Major funding for due process provided by the New Jersey State Bar Foundation, committed to educating the public about the law, and by the Fund for New Jersey, supporting informed citizens for an effective democracy.